Hi guys, today we are going to discuss about health, safety, environment or occupational health and safety or occupational safety and health risk assessment. So key benefits of risk assessment is the first training agenda, elements of OSH system, what is occupational health hazard, occupational health risk assessment, risk management program, training and competency, OSH risk assessment, risk management benefits of consultation, hazard and risk management, steps of risk management, incident reporting procedure, examples of occupational controls performed in any healthcare system or a hospital. FAQs, frequently asked questions. So all the quality management system is started from PDCA, plan, do, check, and act. So it's again renamed into approach, deployment, assessment, review, and results. So there are many type of management systems approaches where we can enlist the management elements under different levels. Like plan, do, check, act. If you look into this, the approach area where they have divided the planning section, business strategy, or such or occupational safety or health and safety policy, mobile mobilizing resources, or such gap analysis against occupational safety hazards, identified safety elements, identified policies, relevant policies, identify, assess, or such hazards and risks, define the roles and responsibilities of staff. So up to here, these are coming under the planning section. And from define roles and responsibilities, set action plan, set objectives, set timelines, then develop OSHMS in accordance with the minimum legal requirements, then informing or implementing OSHMS system, conducting awareness training. These are coming under do factors. And then again, we'll go to check factor, that is PDCA check, PDCC check factor, monitoring, audit and through auditing inspections or a third party or an external party or by a legal authority to check for any non-compliances or any corrective actions required to manage by the company. So report occupational safety or health and safety performance to the regulatory requirement or regulatory bodies is another important action. Then we will come to the act section, that is divided into review and results. So management review and results. So when you will do plan in the beginning of the year and the end of the year, you will do the review of that same plan, how much you have achieved. So that kind of management system you will implement, you can even identify the roles and responsibility you identified to the staff has been implemented completely. So you can assess the staff based on their plan which you have given to them. So based on the plan which you have given to them, they accomplished the plan, you are reaching to that, this here they have implemented the requirements. I hope you understand the management system or a management system into any health and safety or quality management system which is running under PDCA approach. So the key benefits of risk assessment is number one is reduce injuries, illness, and incidents at the workplace. Then reduce corporate risk and liabilities. Example, if any accident happen, It will be a liability to the people, it will be a liability to the company, and the risk to the risk factors which is faced by the employees will be costing to the company again. So the reduced corporate risk and liabilities is another important aspects of risk management. It can be a enterprise management level risk assessment, which will be going to every department by identifying their their SWOT analysis, that is called strength, opportunities, threats, and opportunities. SWOT analysis. So if you will look into any department, there will be some positive aspects and negative aspects. So minimize the negative aspects and push the positive aspect. Your department will be benefitable or profitable to your organization. Improve business efficiency, increased staff well-being and morale. So increase staff well-being and morale when you will achieve, when there is no accident incidents in the company, when there is no liabilities to the company, when timely salaries, timely insurance, everything is provided, the well-being and morale of the company staff will be very high. No accident, no incidents. There is a health and safety manager available to look after the staff welfare, staff health and safety, staff medical checkups, periodic medical checkup, their campaigns, health campaigns. So these kind of things will increase the well-being and morale of the staff in the company. Improved OSH standards, improved occupational safety, or a quality standard, it will again give a positive aspect to the towards the company management system. Then we will go to like key elements of a mandatory requirements of health and safety management system, that is called elements. So we will start with uh, where we will start with, it will be any organization. When you start organization, the risk management is the number one aspect you have to start with. So you have to go through the complete organizational you know into system into cut into pieces. It will be starting with the risk management of each of your departments. So when you look into the departments risk, you will have to identify the high risk department, low risk department, and medium risk department serially, like high, medium, and low. So when you go for first, you have to address the high risk departments. So what you have to do? You have to do a risk assessment, a risk management, risk mitigation control measures, a risk, quantifying the risk into a matrix, and again control measures for that risk. Then again reviewing that risk, identifying, uh, you know, uh, additional control measures. Then again reviewing the risk and coming into a LRP level, a as low as reasonably practicable level. That's called LRP. So whenever a risk is coming to LRP level, your company can run without any hindrance. So whenever there is a risk, you have to stop that process for a while to put the additional control measures and reduce the risk into a reasonably practical level. Consultation and communication is another program which we will be communicating with all the staff mainly about the risk and risk mitigation policy, risk mitigation procedures, risk mitigation training. So everything is related to your risk related emergency management, monitoring, investigation, and incident reporting of your risk, audit and inspection of your high risk activities, compliance and management review as per legal requirement, how to control the risk management, roles and responsibility of each staff, how to control the risk mitigation, what is their role in case of emergency management or a high risk activity when they will control, they will carry out the high risk activity. Management of contractor is another aspect also. So where you will identify how the manager of contracting team to perform with your organization, how they will control the risk factors to reduce your liabilities. So everything is based on the risk. So when you control the risk, your organization will run very well. So what is occupational hazard? What is hazard? Anything has a potential to cause you harm to your health or reputation or your legal requirements in the country. So anything has a potential to cause you harm. These agents may be biological, chemical, physical, ergonomic, or psychosocial in nature. So what are the types of hazards in an organization? It may be biological, chemical, physical, ergonomic, or psychosocial. So psychosocial means your mental stress, your lone work activity, your high risk activity with your, you are afraid of to do something. Ergonomic means all things related to your ergonomics. Ergo means work related incidents, accidents, stress, injuries. So anything has which is leading to your reputational task, which is giving to your reputational job is giving to your problem, your equipments, worksite equipments is giving a problem to your back pain or something like that, work related issues, which is called ergonomic factors. Physical factors means any sharp injuries or sharp matters or a sharp knife you are using at your work or anything cause a physical risk like trip, falls, all these are physical risk. Chemical, biological. So these are the chemical factors which will give your problem to your health. Suppose you are working a highly hazardous chemical in a laboratory or a paint company where you will have a problem with your lungs and your you know uh, breathing system, all this thing like we will have a problem with your respiratory hazards or something will develop in your body. This is called because of chemical hazard. So every hazard is not a risk. If it is so, we cannot work in our organization because electricity is a hazard, fire is a hazard. But fire, all the hazards are not a risk. So when it is uncontrolled, that time it is becoming a risk. Physical hazards, example, slip, trip, falls, exposure to hot, noise, etc. Chemical, as we discussed, toxic gases, noxious fumes, and corrosive liquids. Ergonomic, as we said, height or workbench or because of the workbench, you are always, leaning and working, your backbone is started paining or you have a pain at your back, these kind of things because of ergonomic hazards. So radiation hazards is another hazard in a organization like hospital or a clinic where the x-ray machines and high power lasers or radioactive materials are on whenever it is required for a patient. Psychological hazards such as stress from equipment handling or overwork, biological hazards such as syringes containing potentially infected blood, specimen containers carrying potentially infected materials. So hazards are normally classified according to the severity of their adverse health effects. So we have to understand what is this adverse health effect. So for this we have to do a risk assessment. So when you will do systematic identification of a hazard in the workplace, subsequent evaluation of health risk, the process of taking existing control measures into account and identifying and recommends further preventive controls action where appropriate. This is called risk control measures. What is risk management? Risk management program is addressing the following. Risk management is an integral part of occupational safety and health culture and practices. Risk management applicable to all activities that undertakes and all the phases of a project, development, or during your commissioning, decommissioning, demolition, any stage of your activity, it is very important. So whenever there is a change management, you need to do a risk assessment. Whenever there is a demolition activity, you have to do a risk assessment. Whenever a project is commissioning, we need to do a risk assessment. So based on that control measures, we will develop our policy, standard operating procedures, plans, etc. Risk management methodologies are based on competencies. So what is competency? We must know. For any employee, we have to develop a competency, specific competency to perform that task. So that is called the competency. So based on the consultation with employees, contractor, and other stakeholders, we have to develop our risk management program. Incorporate recognized steps of risk assessment that we'll discuss in the next few slides. Address supply chain contractor undertakings. Address the human behavior including people specific or special needs of young persons or special needs people, those who are coming to our organization. Identify hazards outside the workplace capability capable of adversely affecting the work. So identify the hazards outside the workplace capable of adversely affecting the work. Suppose our work is nearby to a quarry or nearby to a hospital. If you are, because of their infectious diseases, our people should not be infected. So you have to identify the hazards outside your workplace also sometimes, or the environment of that workplace, like as we discussed, where a quarry is operating, your building is shaking all the times, and sometimes even the rocks may come and fall on your building top. Assess hazards presented by inclement weather or emergency situations like a cyclone, or a or because of a rain or a earthquake. These kind of hazards present in that inclement weather, emergency situations can arise, where there's a flood can occur because of heavy rain. Address potential risks to the present persons not in the entity employment. Address the potential risk to the persons not in the entity's employment. So how we will address for them, like a visitor in a school, how we will address, we have to give some specific area where they have to come and sit. The visitors along will be there where they have to allowed to sit. No other area they are permitted to go, which may be high risk for our small children. So like these situations, it will be based on the identified areas, identified locations. There will be controlled by doing these kind of control measures. Address the plant, machinery, equipment, substances and material at the workplace. So we have to identify the plant, how much it is risk, where is a there is a chance of drawing inside the, suppose you have equipment running machinery, where your fingers, hand can trap inside, your dress can go inside. So these are all kind of trap hazards we have to identify. So whenever there's a trap, it should trip automatically. This is what the control measure. So machinery, equipment, high noise equipment, machineries will be there, where you have to take care of your ears, your noise hazard, your control measures for your earplug, or your controlling the hours to work over there. Like as per international standard 85 decibel, they're allowed to work 8 hours. So materials at workplace, as we discussed, paint or chemicals in the workplace, again making problem to the health and safety of the employees. Address design at work areas, process work organization and operating procedures. Design of work, as we discussed, economic factors it is addressing. Document, record, communicate result of risk management activity. Why we are recommending the risk assessment? Because every new coming staff will be able to go through that risk register or risk assessment, which will be easy way to communicate with the newcomer with all the high risk activity at one point. Within its available control measures also learned by that staff, but immediately soon after joining, once he read the completed risk assessment, which is made by too many, n number of staff, the expertise staff efforts, and which will be giving to a spoon feeding to the newcomer within first week of their joining. Address routine and non-routine activities of all persons having access to the workplace. So we have to identify what kind of high risk activity, what are the kinds of routine or activity, what kind of non-routine activity or high risk activity in the organization. So all routine activity is required only a competency, whereas all non-routine activity or a high risk activity, you needed a work permit and a risk assessment for the same. Training and competency, as we discussed, those carrying out risk assessment should be competent to do the same. Competency is defined as a number of ways cannot be achieved but just attending a training course. Competence is defined as sufficient training and experience or knowledge and other qualities enable a person or property to undertake the measures need to comply with legal or legislative requirement. So competence, we must know who is doing your risk assessment, who is participating in your risk assessment, who is contributing towards your risk assessment. So simple situation may be only require the following: an understanding of relevant best practice, an understanding of process being assessed, awareness of limitations of one's own experience and knowledge, and the willingness and ability to supplement existing experience and knowledge when necessary by obtaining external help and advice. More complicated situations will require the competent person to have a higher level of knowledge and experience. More complex or highly technical situations will call for specific applied knowledge and skills which can be offered by appropriately qualified specialists. Here you need the expertise opinion from a consultant or a trainer where they will come and give you risk assessment training. Employers to check the appropriate OSH qualification, some of them which may be competency based and some industry specific, or a membership or a professional membership of a professional body or a similar organization to an approximate level, approximate part of OSH, or satisfy themselves that assistance by appointing sufficiently high level competence. Example, IOSH management system. Somebody is IIRS having a membership in IIRM. Somebody is having membership in OSHA. So these kind of memberships are there, like ISO. There are some organizations, they are also giving some memberships, some licensing they are giving. Some companies they are giving, like they have their own accredited people are available. So these kind of competency level is required sometimes. OSH risk assessment. OSH risk assessment is an ongoing process that shall be undertaken when planning or making a change at the workplace, or a procedure or an activity or a practice. So when planning or making a change to a work procedure, activity or practice. When introducing new plant, equipment, material or substances into the workplace. After an OSH incident, including near misses. So whenever there is an incident, we need to do a risk assessment to avoid the recurrence of the similar incidents. Introduction of new workers. Whenever a new employee is joining in your company, we need to do an orientation or induction. Then we have to do ongoing training based on the competencies. Presence of a high level of risk associated with specific work activity, example, confined space or a fire near to an oil tank, example, welding near to an oil tank. These kind of high risk activity we needed very closely monitored risk assessment, and the control measures should be very highly stringent. At regular or scheduled intervals approximate to a nature, the workplace and the hazards present. So at regular scheduled intervals appropriate to nature of workplace and hazards present. As I said, near to a fire and diesel tank, fire pump diesel tank, we need to continuous monitoring, or a petrol tank we need to monitor by electronic supported fire extinguishment systems, or an automatic fire suppression system, which will be regularly monitored, those kind of situations or areas. When a legislative obligation changes and before work activity begins. Risk management benefits of consultation. Consultation between management, workers and stakeholders is a beneficial thought throughout the risk management process, because it brings together different areas of expertise to identify and analyze the risk, and allows those with the day-to-day experience of hazards provide a valuable input. Allows workers to have ownership of his risk and solutions, because any healthcare worker or any risk management a specialist may not be able to provide all the control measures to situations, all the situations. So we are taking the expert opinion of that specific area manager to identify the control measures and implement those things. Allows the workers to have an ownership of risk and solutions. We are allowing that each worker to take their own responsibility, their own identification, their own risk control measures, and to implement throughout the organization. So it will unify the risk assessment for entire organization. It will give control measures throughout the organization for all. Increase the likelihood that workers will be committed to implement the control measures because they understand the way why they are being imposed. Because when you identify yourself the control measures, you will be having more understanding why those control measures are implemented. Increase workers morale, satisfaction, retention rates, as staff feel that they are being listened to and involved. Improves trust, communication, and teamwork. So we need, every organization need to have these aspects: the trust, communication, and teamwork, which will be giving a complete team building. Like a family, they will be continuing the business. Improves productivity as a result of better decision making process. So productivity is based on the decision makers, process identifiers, and decision making process. So we are giving the chance to the employees to take part in this. Contribute to develop a positive health and safety culture in the workplace by increasing team commitment to workplace health and safety. Now we will go to understand steps of risk assessment. There are 5 identified steps in any risk assessment. That is, identifying the hazards based on experience, record data after information, and other information. Sorry. So identify hazards based on experience, recorded data, and other information. Identify who can be harmed or what can be damaged and how. Understand who can be harmed or what can be damaged from the risk and what extent. Evaluate the risk and select additional control measures if required. Using a recognized method, evaluate the risk level, evaluate the level of risk and decide if it is required to implement any additional control measures. Formulate control measures to reduce the risk. Example, acceptance into a low and reasonably practicable. So acceptable as low as reasonably practicable. That is called LRP. I have discussed in the beginning. Implement the selected control measures in the workplace. Monitor the control measures to ensure that they are working correctly to control the risk and that not other risk has been introduced. Suppose you are giving a control measures, it should not pose another risk to the employees. Incorporate management of changes process within the entity. So during this also you are supposed to do a risk assessment. So as we discussed, step 1, identify all the risk activities, issues in the workplace. So all the work activities should be looked into, plant and machinery should be looked into to identify these hazards. So known hazards, you are known, like say example, like chemicals, your paint, your fire, your petroleum, your diesel, your vehicle, your knife, your stress. So incident reports, based on the unpleasant occurrences, we are reporting the incidents and known near misses. So from the previous year incident report, previous year reporting, you will identify all the known near misses and hazards and risk or incidents reported in the previous year. So these kind of things you will identify to make the control measure for the company. Step 2, identify whom or what can be harmed or how it can be damaged. So make a list of these group of type of people like employees, visitors, contractors, members of public, consumers, products or services, specific, sensitive, protected environment areas like environment risk, plant, equipment, property damage. Step 3, evaluate the select and select the additional control measures as we discussed. Evaluating the risk about the developing and understanding the risk. It provides input to decisions on what risk need to be controlled and the most appropriate and the cost effectiveness of the risk treatment strategies. Risk analysis involves consideration of those sources of risk, their consequences of the likelihood that those consequences may occur. If it is occur, how much it can give consequence. The factors that affect the consequence and likelihood may be identified. The risk is analyzed by combining consequences and their likelihood. So, how frequently these risks can happen? How much intensive the consequence will be? Based on these only, we are identifying the risk and we are quantifying the risk by putting them into a matrix. So the level of risk is calculated by multiplying the consequence score and probability of occurrence together. So we are multiplying the consequence, the likelihood, and probability is called likelihood, consequence is called after effect, or the residual effect you can also call. So what is risk? Consequence score like multiplied by likelihood occurrence. So consequences, the likelihood may be estimated using statistical methodologies or analysis by calculations. Evaluate the select additional control measures. Why we need some additional control measures? Based on the past records, practices, and relevant experience what you have in the previous company or the same company, relevant published literatures like how much risk it is kind of new identified chemical. Based on that, safety data sheet provided by the company, that is a published literature. Then economic, engineering, and other models. So how we can do control measures based on your financial condition of the company, your engineering technology, technological advancement of your company, and other models can be a manual model, can be other things, and specialist expert judgment. Techniques include structured interviews and expert of that area of interest, structured interviews with experts in the area of interest, use multidisciplinary groups of experts, that is called your specialized people in the departments, individual evaluations using questionnaires, use of models and simulations, where appropriate the confidence placed on estimates of levels of risk shall be assumptions made, the analysis shall be clearly stated. For discharge or emission of a pollutant, evaluating factors such as those listed below should be help in assessment of relative consequence. So persistence, toxicity, health effect, concentration of chemical. Suppose it is liquefied or put more water in that, it is getting diluted, right? So the risk consequence will reduce. Suppose you are using a high risk chemical. Volume of discharge, if it is very small volume of H2S is leaked, the risk is very low. Whereas if it is high volume, the death can happen. Duration of the discharge, how long it is discharged. Suppose petroleum is leaked for a second, it is not that much risk. But it is for half an hour, it is very high risk. Proximity to water bodies is environmental factors. It is going to the water bodies and it will pollute for the all the animals and man material like man and other water bodies if it is polluted. Potential dilution, the area of land marine waters affected, taking into account secondary consequences and existing mitigation measures. So this is the hierarchy of control. Any kind of occupational or environmental risk identified, how we have to reduce the the risk factor or implementing the control measures, we are choosing some hierarchy methodology. First one is elimination. eliminate the risk by removing the hazard. Suppose you have a high noise equipment, you install it far away site from your office areas, so the noise hazard to the office spaces it is reduced. Or you put a glass coverage for that noisy equipment, and that sound will not come outside. It is called elimination. Substitution means substitute less hazard material, equipment, process, or substance. Example: you have a high risk chemical which is inhalation is resulting the staff to have like nausea or vomiting or something. You are substituting the chemical to a low risk chemical which is not giving those kind of symptoms or risk to the staff. Engineering control, as I said, when there is a noise, we are applying a glass covering to that noisy area. That is called engineering control. So make the structural changes to work environment, work system, tools, equipment, use mechanical aids or manual handling devices. Enclose or isolate the hazard through use of guards, remote handling techniques, provide local exhaust ventilation. Suppose you have a smoke in that area or a in the room where you are working with, you have to use the local exhaust ventilation where this exhaust fume will be going away from your area. It will not come to your room. This is called engineering control isolation. Administrative control, appropriate administrative procedures such as policies, guidelines, standard operating procedures, registers, work permit, risk registers, safety signages, job rotation, job timing, routine, maintenance and housekeeping, providing training, hazards and correct work procedure. These all called administrative controls. Personal protective equipment is nothing is worked. The last control is providing correctly fitted and appropriately proper maintained personal protective equipment and protective clothing and training of its use. Example, during the situation of Ebola or COVID-19, people are using these personal protective measures because no other protections are that much effective whenever, especially for the healthcare workers, those who are closely interacting with the patients. So to clear understand, suppose you have a vehicle with which is not working, the brake is not working in your vehicle. What you will do, you will try to eliminate it. You will tell, yeah, give this to the workshop, I will take another vehicle. Okay, that is called elimination. Substitution, yes, you are telling your friend, give me your vehicle, I will use your vehicle instead of the brake failed own vehicle. Then engineering control, you are giving that to the workshop and you are getting it repaired. That is called engineering control. Administrative control, you call the office manager who is controlling your vehicles and transportation, ask them to provide a vehicle. And the personal protective equipment, suppose you're riding a vehicle such as bike or something, you are always using your helmet. There is no other way. If you fall down, that only can save you from the accident or injury. Step 4, implement the control measures. So in the evaluation of these control measures shall be taken, consideration shall be given to reducing the risk to a level of deemed alarm. This includes the consideration of legal requirements, international standard guidelines, entity OSH policy and objectives, availability of resources, cost and benefits, status of scientific and technical knowledge. As we discussed, control measures will be based on availability of funds, based on legal requirements. Suppose you need to have a fire suppression system, based on the legal requirements, you must have. There is no other option in your company, correct? And cost and benefits also will control sometimes the size of that fire suppression system will be based on the cost and benefits. It's even though if it is legal requirement, will go for a low cost equipment, right? The consequence, as we discussed, human health and safety, production loss, total cost of impact or incident event. Suppose you will have loss of that company reputation. So these are the consequences they are given in the second column. Insignificant consequences, minor, moderate, major and catastrophic. Then we are giving the likelihood, frequent, often, likely, possible and rare. So frequent means occurs frequently, probability will be 5. It is quantifying into number. This number will be multiplied by the other severity number. So this will be your risk result or matrix. It will go to the particular column of matrix. We will see the consequence is given on top and likelihood is given on the left side. So when it comes to the significant rare, it is meeting in the column 1. When it's likely and moderate, it is meeting in the column number 9. So that is the amber column where it could be maximum allowed to be present. If you go to, there will be a line between these frequent, often, and it's going through between 3 and 4, between 6 and 8, between 9 and 12, and it will go to under 4 and 5. So it will be the allowed column where you can work if the risk is available in that column. So your all activity will fall in these numbering columns of 1 to 25. So these activities are quantified in that numbers. Instead of these numbers, you will write your activity in those columns, and you will be able to provide the permission if it is falling in the yellow column, and only one number amber column, that is number 9 column, the work is allowed to do that. That is also with additional control measures. If you see 8 to 12, activity or industry should be modified to include remedial planning and action and be subject to the detailed OSH assessment. This is what 8 to 12 high risk tasks should be happen in your organization. So risk register is a register where you are enlisting all high risk activity and its control measures and its affected department, what kind of hazard it can provide and what risk it is producing, and affected department type of risk in that. So example, occupational and environmental safety, and likelihood and consequence multiplication is a risk factor. L into C. The current control measure is what you are doing before applying these control measures, how the risk was. The initial risk assessment is that. Then after current control measure, you are doing a residual risk rating. That is a risk assessment. Then you are deciding you need a additional sorry. So current control measures, then you are going to the residual risk rating, additional control measures after the residual rate is falling. As I said, 8 to 12 category, again it is residual for risk is falling in that category. We need some additional risk control measures, and its start date, end date, who is doing that, responsibility, how we are reviewing them, we are allowing them to work based on these kind of certain situations, those who are identifying in that. So this risk register is allowing the people to work even though the situation needed, like some kind of high risk activity is going on, the risk ranking is so high, the control measures are so much, and the time scales are limited. Workers action honors and review dates we are identifying, we are giving, we are distributing the risk to the entire people of that department. Operational safety, these are the similar way methodology. We have to know the safety cases. We have to understand when there are cases like reported major hazards and incident, that we have to report to the legal required parties. Monitoring investigation, how it happened, what it happened, when it happened, what control measures we have to take if it comes again in future. So these are all things. Monitoring, investigation, and reporting parts, incident reporting and investigation. How frequently we have to report to the legal required parties, how frequently report to in your department, quality department, in your organization, quality department, how they will report to the legal authorities. These all are reporting programs you must have. Then adding inspection and audit procedure, I have addressed another specific session for this, though you must know what kind of audit inspection checklist we are using in your organization, what kind of activities should be included in that, what kind of hazardous risk activities you have placed in this inspection methodology, legal compliance, whether we met or not. That is another register called legal register we need to maintain in the department, and the KPIs based on the requirements of our owner, or based on our department requirement from the legal authorities or international standards. We have to maintain some key performance indicators, that is called KPIs. FAQ. Who is our sector regulatory authority? In any country, in the healthcare sector, the sector regulatory authority will be Department of Health. If the sector is in the municipality sector, then it will be municipality. Suppose you are working in a building which is under municipal commissioner office. You are working in a building where it is the municipality is having more, suppose you are working in a market building, the municipality inspection is very important for you. So your sector regulatory authority will be municipality. So define OSH. An integrated system developed and implemented to include all factors related to occupational safety and health for the purpose of protecting human health and ensuring safety of employees in the workplace. How many elements are there in the OSH or HSE safety management system? 9 elements. What is COP? Code of practice. It is called code of practice, providing minimum mandatory requirements on a specific subject, example, personal protective equipment or economics or a switching on procedure of a uh, equipment like a standard operating procedure. It is also called standard operating procedure, SOP. So based on the requirement, we can make plan, policy, SOP, COP, these kind of policies. Thank you. Hope you enjoyed the session.